Everybody, it's a beautiful day here in Maryland and just enjoying the beautiful weather. Hope you guys are too. I just wanted to thank everybody for taking the time to comment on my posts yesterday. I'm not changing my content completely, so don't worry. I'm still going to be doing before and afters and OR reveals and things like that. So not to worry, but on some days I just can't get out of the OR early enough to get a real post up. So I'm going to sort of mix in some content for you. One of the things that people always ask me is, why did I get into after weight loss plastic surgery and why are you so passionate about it? And in college, I was a double major in psychology as well as biological basis of behavior. So I've always been very interested in the mind-body connection. And when I was in medical school, what really sort of drove me to plastic surgery is that I saw a patient who was undergoing a mastectomy, obviously very traumatic and emotional for women. And the plastic surgeon came in and reconstructed that patient's breast immediately after the mastectomy, and really allowed them to sort of feel whole and complete and sort of on that pathway to, sort of feeling normal. And that was really what attracted me to plastic surgery, because it's really the only field in medicine where you can not only help somebody physically, but also emotionally. So when I originally started getting into plastic surgery, I thought I was going down that route. Unfortunately, my mom passed away from breast cancer while I was in my plastic surgery residency, or should I say just following. And I just decided it just wasn't the route for me to go. Emotionally, I just didn't feel like I could sort of offer as much as I could to my patients. And so while I was in my residency, though, I saw an after weight loss patient. She underwent a big body lift. It was a huge procedure, and I was fascinated by it. I never saw it before, and I thought, wow, this is a huge procedure. Why did this patient undergo this type of surgery? And fortunately, the next day I didn't have an OR case, so I went in to talk to her, and I said, I helped you with your case. I really enjoyed it. Can I ask you, why did you, want to do this surgery? And she said, after losing 100 pounds, despite everyone calling me thin and the number on the scale, I just always felt fat. I never felt like a normal person, and I needed to undergo this skin removal to, feel better about myself. And at that moment, it just all clicked. And I said to myself, this is sort of what I want to do. This is amazing. And I did a fellowship in after weight loss plastic surgery, and that's really it in a nutshell. So see you guys soon, and I don't know.